OZEMPIC and RYBELSUS are both medications used to treat type 2 diabetes, and they belong to the same class of drugs known as GLP-1 receptor agonists. Despite their similarities, there are significant differences between them, including their formulation, administration, and specific benefits and drawbacks. Differences in formulation and administration. OZEMPIC. Formulation: injectable. Administration: administered via a subcutaneous injection once a week. Active ingredient: semaglutide. RYBELSUS. Formulation: oral tablet. Administration: taken once daily by mouth. Active ingredient: semaglutide. Mechanism of action. Both OZEMPIC and RYBELSUS work by mimicking the action of the GLP-1 hormone, which increases insulin secretion, decreases glucagon release, and slows gastric emptying. This helps to lower blood sugar levels in patients with type 2 diabetes. Pros and cons. OZEMPIC. Pros. Convenience of weekly dosing only requires a once-weekly injection, which can be more convenient for patients who prefer less frequent dosing. Potent glycemic control, effective in significantly lowering HbA1c levels. Weight loss, often associated with weight loss, which can be beneficial for overweight or obese patients with type 2 diabetes. Cardiovascular benefits, has been shown to reduce the risk of major cardiovascular events in patients with type 2 diabetes. Cons. Injection: some patients may dislike or fear injections, leading to lower adherence. Storage: requires refrigeration, which can be inconvenient for some patients. Side effects: can cause gastrointestinal issues such as nausea, vomiting, and diarrhea, especially when starting the treatment. RYBELSUS. Pros. Oral administration, taken as a daily pill, which can be more acceptable and convenient for patients who prefer oral medication. Effective glycemic control, also effective in lowering HbA1c levels. Weight loss, associated with weight loss, similar to OZEMPIC. No injection required, eliminates the need for injections, which can improve patient adherence and comfort. Cons. Daily dosing, requires daily administration, which some patients might find less convenient compared to weekly injections. Fasting requirement, must be taken on an empty stomach, at least 30 minutes before the first food, beverage, or other oral medications of the day. Side effects: similar gastrointestinal side effects, such as nausea, vomiting, and diarrhea. Bioavailability: the absorption of the oral form can be variable, and its efficacy might be influenced by the patient's gastrointestinal conditions. Conclusion. Both OZEMPIC and RYBELSUS are effective treatments for type 2 diabetes, offering significant benefits in glycemic control and weight loss. The choice between them often depends on patient preference, lifestyle, and specific medical needs. OZEMPIC might be more suitable for patients who prefer less frequent dosing and are comfortable with injections. RYBELSUS could be a better option for those who prefer oral medication and are willing to adhere to the daily dosing schedule with its specific administration requirements. Ultimately, the decision should be made in consultation with a healthcare provider, taking into account the patient's individual preferences, medical history, and treatment goals.